Okay, Assalamualaikum and hi, we meet again in the SPS 477's Physiology of Sport and Exercise. So now we go into the next topics. Topic 5, hormonal response during exercise. So hormonal adaptation to different exercise intensity. So this is the overview about this topic. So, hormones regulate energy metabolism, cardiovascular functions, and tissue repair. Exercise cause acute, which mean immediate, and chronics, which mean the long-term hormonal changes. The key hormones is catecholamines, okay, divided by two, epinephrines and norepinephrines, and then cortisols, the stress hormones, the growth hormones, testosterone, insulin, and IGF 1s. So we go into the hormonal response for the low to moderate intensity exercise. So we can see that once, okay. So moderates is increase in catecholamines, okay, support by the fat metabolism and the heart rates. Okay, slightly cortisol's increase enhance energy availability. So cortisol will be increased also, okay, based on the duration of the activity or exercise. So small rise in the growth hormones, okay, promote fat metabolism. Okay, if you all knows, okay, the growth hormones will be increased, okay, slightly higher in the high intensity activity. So that's why it's a small rise in the growth hormones, because this is low to moderate intensity activity or exercise. Insulin decrease slightly and enhance glucose uptake via muscle contraction. So insulin will be decreased by the pancreas, and then also pancreas will be increase glucagon, okay, based on the intensity or duration of activity or exercise. Okay. Okay, this is hormonal response, low to the moderate intensity exercise by the hormonal levels, and then the VO2 max rise to the 70%. Okay, you can see from the chart here, okay, that show the differences, okay, between the hormones epinephrine, norepinephrine, cortisol, insulin, and glucagon. Okay, from the chart here show that slightly increase, okay, by the cortisol and glucagon, and then will be the increased level is epinephrine and non-epinephrines, okay, for this kind of activity. Hormonal response for the high intensity exercise. So sharp increase in epinephrines and non-epinephrines glycogen breakdowns. Significant cortisols arise, support gluconeogenesis and inflammation control. Growth hormone spike, increase fat mobilizations and tissue recovery. Insulin sharply drop due to sympathetic nervous activity. So this Okay, so this is the table that show the hormonal response for the high intensity exercise. Okay, so you can see that one, okay, for the low intensity and high intensity. For the hormonal level for the epinephrines and non-epinephrines show it the significant increasing, okay, during perform this kind of activity, okay, for the high intensity exercise compared to the low intensity exercise. And then the insulin levels, okay, surely that the numbers of the low compared to the others hormonal. So hormonal response for the resistant anaerobic exercise. So the hormone testosterone increase during the heavy lifting, okay, both protein synthesis, growth hormones, and IGF-1 release support tissue remodeling and hypertrophy. So cortisol increase with the high volume or loads, okay, mobilize energy, and catecholamine rise support muscle contraction and energy supply. So this is the tables show the difference, okay, between the hormonal response, okay, from the endurance training and resistance training, okay, for the hormonal response comparisons, okay. So you can see that one in the table here, okay, show that growth hormones is mostly highest compared to the others hormone for the endurance training and resistance training. And then for the level of testosterone will be increased for the resistance training, okay, so slightly decreased for the endurance training. So that's mean when perform the resistance exercise, okay, we all know that the growth hormone will be highest compared to the other hormones. So chronic adaptation with the regular trainings. Okay, so hormonal spike become more efficient and targeted. Resting level of the most hormones remain stable or slightly reduced, and trained individuals show faster recovery and greater receptor sensitivity. Long-term training enhance insulin sensitivity and fat metabolism. So chronic adaptation with the regular training, so that show the hormonal response timeline during exercise. Okay, you can see that one that show the time and then the level of the hormone during perform the exercise for the started and the ended hormones. Okay, so you can see the highest value, okay, for the time to exercise. Okay. So chronic adaptation with regular training, exercise induce response adaptation over time. So during perform this activity or exercise, okay, which hormonal with more response highest compared to the other hormonals, okay. Disruptions, overtrainings, and low energy. So intense training plus inadequate nutrition will be lead to the hormonal imbalance. Can may lead to the increased level of cortisols, decreased reproductive hormones, example estrogen or testosterone, menstrual dysfunction in females, example exercise-induced amenorrhea, known as a REDS, relative energy deficiency in sport. Okay, you can see here that the sum of the symptoms will be happens if the persons get the REDS. Okay, for example, cardiovascular disorder, increased risk of injuries, and then for the females, okay, that we come into the female athlete triads, for example, reduced bone density and then menstrual disorder. So this is the key takeaway for the our chapter today. So hormonal response are intensity dependence. Higher intensity equal to the greater hormonal changes. Regular training refines hormonal efficiency. So program design should be based on volume, intensity, rest will be affect the hormonal levels, and then should be take the balanced nutrition is essential to avoid hormonal dysfunction, especially in females. Okay, so that's all from me for this topic. So thank you for the listening. Assalamualaikum, and inshallah we'll be see you again